Treatment for symptom-producing sick-sinus syndrome includes Option A. Beta-arterogenic blockage. Option B. Ventilator support. Option C. Pacemaker insertion. Option D. Synchronized cardioversion. The answer is Option C. Pacemaker insertion. A pacemaker is used to maintain a steady heart rate in patients with sick sinus syndrome. The treatment of choice for a patient with ventricular fibrillation. Option A. Defibrillation. Option B. Transesophageal pacing. Option C. Synchronized cardioversion. Option D. Digoxin administration. The answer is Option A. Defibrillation. Patient with ventricular fibrillation require defibrillation.
The term pulseless
electrical activity refers to condition in which there is Option A. Ventricular rate exceeding 100 beats per minute. Option B. A systole on a monitor or rhythm strip. Option C. An extreme slow heart but no pulse. Option D. Electric activity in the heart but no actual contraction. The answer is Option D. Electrical activity in the heart but no actual contraction. Pulseless electrical activity is electrical activity without mechanical contraction.
The patient is in cardiac arrest with no blood pressure or pulse.
In type 1 second degree AV block, the PR interval Option A varies according to the ventricular response rate. Option B progressively lengthen until a QRS is dropped. Option C remains constant despite an irregular ventricular rhythm. Option D can't be determined. The answer is Option B progressively lengthens until a QRS complex is dropped. Progressive lengthening of PR interval create an irregular ventricular rhythm with a repeating pattern of group of QRS complexes. Those groups are followed by a dropped beat in which the P wave is not followed by a QRS complex. A focal or diffuse inflammation of the cardiac muscle is known as Option A. Endocarditis. Option B. Pericarditis. Option C. Myocarditis. Option D. Myocardial infarction. The answer is Option C. Myocarditis. Myocarditis is a focal or diffuse inflammation of the myocardium. It may be acute or chronic and can strike at any age. Chest pain is described as pleuritic when it Option A resolved with sublingual nitroglycerin. Option B occur only during sleep. Option C increases with deep inspiration and decreases when the patient sits up and lean forward. Option D resolve within a deep breath. The answer is Option C increase with deep inspiration and decrease when the patient sits up and lean forward. Pleuritic pain increases with deep inspiration and decreases when the patient sits up and lean forward. This decrease occurs because leaning forward pulls the heart away from the diaphragmatic pleura of the lung. Three risk factors involved in acute coronary syndrome include Option A. Smoking, family history of disease and diabetes. Option B. Family history, diabetes and active lifestyle. Option C. Smoking, diabetes and high density lipoprotein level. Option D. Weight loss, smoking and low high density lipoprotein level. The answer is Option A. Smoking, family history of heart disease and diabetes. Risk factors of developing acute coronary syndrome include family history of disease, obesity, smoking, a high fat and high carbohydrate diet, sedentary lifestyle, menopause, stress, diabetes, hypertension, and hyperlipoproteinemia. Suspect an abdominal aortic aneurysm in a patient who complains of generalized steady abdominal pain and has Option A. Pulsating mass in the periumbilical area. Option B. Elevated cardiac enzyme. Option C. Positive Babinski sign. Option D. Pink frothy sputum. The answer is Option A. Pulsating mass in the periumbilical area. Signs of an abdominal aortic aneurysm include generalized steady abdominal pain, lower back pain that unaffected by movement, gastric or abdominal fullness,
Palpable pulsating mass in the periumbilical area, systolic brood over the aorta on auscultation of abdomen.
brood over femoral arteries, and hypertension when aneurysm rupture. An important diagnostic test used to identify peripheral artery disease is option A electrocardiography, option B EEG, option C arteriography, option D cardiac catheterization. The answer is option C arteriography. Arteriography can demonstrate the thrombus or embolus location and degrees of obstruction and can help evaluate the collateral circulation. This is the gold standard of diagnostic testing. What is the most common site of injury from blunt chest trauma? Option A aorta, option B left ventricle, option C superior vena cava, option D right ventricle. The answer is option D right ventricle. The right ventricle is the most common site of injury from a blunt chest trauma because of its location directly behind the sternum. Emergency treatment of hypovolemic shock include option A administration of antibiotic, option B administration of IV fluid or blood products, option C relief of pain, option D administration of vasodilators. The answer is option B administration of IV fluid or blood products. Emergency treatment relies on prompt and adequate fluid and blood replacement to restore intravascular volume and to raise systolic blood pressure and maintain it above 90 mm of Hg. Rapid infusion of normal saline or renal lactate solution and possibly albumin or other plasma expanders may expand volume adequately until whole blood can be matched. What is the immediate goal of treatment of cardiac tamponade? Option A relieving pain, option B alleviating anxiety, option C improving mobility, option D relieving intrapericardial pressure. The answer is option D relieving intrapericardial pressure. The goal of treatment is to relieve intrapericardial pressure and cardiac compression by removing accumulated blood or fluid.